it's Nurse Amy here.
And Nurse Carm.
And welcome to the Medical Mission,
where you'll find everything and anything medical related.
In this video, we're going to talk about what to expect postpartum. You're pregnant, you're anxious. We want to give you the rundown of what to expect in the hospital. That's what we do. So, number one, for mom, placenta's delivered. You're going to have a medication called oxytocin. Oxytocin is going to be given to you through an IV. And what oxytocin does, it helps you contract your uterus because you're going to be bleeding after you give birth. This is to be expected. But we want to control that bleeding so you don't, hemorrhage and just bleed and bleed and bleed. So this medication will help you control your bleeding. I also want to say that your uterus contracts naturally. So this is just kind of a boost of what your body already kind of does.
Exactly.
So the nurse will be checking your fundus, which is the top of your uterus. She'll kind of give it a little massage. The massage will help contract it, go to its basically normal size of pre-baby. And this massage also basically prevents a hemorrhage. Vital signs that will be ongoing. So you'll either be hooked on to a blood pressure machine and the vital signs will be going every so often, or a nurse will actually come in and do the vital signs every so often. What else? Right after the nurse of course will check your bleeding, like I said before.
Oftentimes what we'll see in the hospital is that you'll hear a lot of different words being thrown around that you have probably no idea, I've never heard of before. A common term that's used to describe the vaginal bleeding is lochia. And again, it's just to explain to you what that word means, vaginal bleeding. And so if you hear being thrown around, her lochia is small amount, moderate amount, you'll know exactly what they're talking about and it won't make you freaked out.
Exactly. So this is pretty much for mommy, what will happen, whether you had vaginal delivery or a cesarean, and Carm will go into what's going to happen with baby. What are they going to do with my baby?
So on admission, you'll either be again in the same room that you delivered in, or you'll be transferred to another place called postpartum. And in this room, we'll have babies that we'll do a full admission on. And what that means is, of course, the vital signs. Like we said, this is an ongoing thing that you'll be having in the hospital. The next thing is your nurse will explain to you two things that are extremely important for your baby to receive. The first one is the erythromycin gel in the eye. It's a little cream more than a gel. And what we're trying to do in giving the baby this in the eyes is to prevent any bacteria that may have been introduced through the eyes during the delivery process. So the other medication is we give the baby either an intramuscular injection of vitamin K, or we can give it by mouth. What vitamin K really is, it's a coagulation property where your baby naturally has them, but we want to give the baby an extra boost of it. And it's simply just to prevent any other existing bleeding and just to aid the baby in the whole newborn phase. Whether you take it by mouth or intramuscularly, it's really a preference as a parent. When you take it intramuscularly, it's one shot, one time, and you don't have to worry about it again. If you take it by mouth, there's several doses that you have to take outside the hospital in order to complete the treatment of the vitamin K. The next thing that your nurses will do is, again, weigh the baby. And the best part is knowing what your baby's actual measurements are. So this is the cute, fun stuff where we see how long your baby is, the head, what's the measurements, and so you'll get that in a vaccination booklet.
I think some hospitals even do like footprints and
I saw. That's so nice.
Pictures. Not our hospital. But some hospitals do. So this is, the cute fun part and the memories part.
100%.
Also with the vitamin K and antibiotics, we want to give it within the first 6 hours.
Yes.
So it might be done right after your baby you deliver your baby, or we'll put the baby skin to skin. We'll give you a little time to bond, and then we'll kind of do it. But even some nurses will even do it while the baby is skin to skin. But 6 hours is kind of the maximum we want to go. Doesn't mean it's not going to have an effect if it happens after 6 hours, but it has the most effect if it happens within the first 6 hours. Yeah.
Speaking of skin to skin, this is something that you'll be hearing throughout the whole process of your whole stay in the hospital. It's something that we really encourage. It doesn't matter if you're breastfeeding, bottle feeding, whatever. We really want to ensure good bonding between mom, baby, baby, and the dad, grandma, whoever it is. And essentially, skin to skin not only calms your baby down and puts them back into everything is fine perspective, but it also increases bonding between that person who's doing skin to skin with the baby.
Yep.
I'm sure Amy has tons of experiences on how well skin to skin works.
Especially it increases, it just gets those hormones flowing between you and your baby, get that breast milk flowing. There's so many benefits. It regulates your baby's blood sugar, it regulates your baby's temperature. There's just so many benefits of skin to skin. The nurse will be encouraging you to do that during your whole stay.
Exactly.
Yep.
And oftentimes you'll as well hear the nurses telling you to not completely close the baby, and this is really the reason why we're trying to promote this beautiful, loving thing that skin to skin does. Not only benefit emotionally but physiologically for the baby as well.
So don't think your baby is cold if we just plop them skin to skin. Your baby will actually be warmer skin to skin than dressed in the little baby bassinet, whatever you have at your hospital. Versus that, your baby will be warmer, basically.
Exactly. Skin to skin's magic. That's what we say.
Yep. So going through. So this will happen throughout your stay, from placenta delivering until you leave the hospital. Vital signs. We will be checking your vital signs: blood pressure, temperature, respirations, heart rate, all the time for you and the baby. What else is happening skin to skin? We want to help you with how you're going to feed the baby. Do you want a bottle feed? We want to help you if you need help. If you want to breastfeed, a little more challenging, we will be there 100% for sure. We will help. So this will be ongoing, like we said, from placenta delivering until you leave the hospital. Exactly. We're going to assess your bleeding. So we're going to assess your bleeding. That depends on every institution. We do it every 4 hours for the first 24 hours, and then it goes to every 8 hours. Depends on your hospital, guys. But someone has to assess how much you're bleeding. Is this normal? Is this too much, basically, where you're going to hemorrhage? So that will be ongoing. We're going to assess if your fundus, the top of your uterus, is at its normal place, at where it should be, according to the amount of hours, amount of days you are.
Exactly.
So all that will be kind of ongoing. Do you have a tear? Did you tear during your delivery? We have to assess. Do you have pain? Could we give you pain medication for that? Do you have hemorrhoids? Which could have been pre-baby, during pregnancy, or post-baby. Hemorrhoids could happen. Do you have hemorrhoids? Are they hurting you? Can we give you something for them? So all those will be ongoing from beginning to end.
Another thing to mention on the ongoing care in relation to the baby is the jaundice testing, where we will be basically coming in. You'll hear that word jaundice. What is it? We're looking to see if the bilirubin in the baby's body is effectively being excreted to not reach a toxic level. The obvious symptoms are going to be, the nurses will tell you, your baby's skin will look yellow. Again, if there's other accompanying symptoms, but we won't get into that detail, long story short, a nurse is gonna come at 24 hours of life for the baby, and she will test on the baby's chest about here, and she'll press 3 times with a machine that will superficially be able to tell us what the levels in the baby's body of bilirubin are. Depending on the levels, either the nurse will say, great, your baby's at a low risk for jaundice, we're happy, or she'll tell you, we'll do a blood test and we'll see if, you know, we need
if this reading is
accurate.
Yeah.
Exactly.
The baby will have a hearing test done. Again, this depends on the institution. So this is just a first screening of whether or not my baby has hearing problems. A hearing technician will come test your baby for a hearing test.
Yes,
That's it, basically. Doesn't mean your baby has, so your baby will pass or fail. Doesn't necessarily mean your baby will have hearing problems now or in the future. This is just really a first screening. It could kind of predict what your baby will go through in the future.
Exactly.
Yep. You're going to be seen by a doctor before you go home. You and your baby, or just your baby. If you are a no complication delivery, you might not be seen.
Exactly.
Has to be cleared by a doctor.
100%.
You'll have a metabolic
screening.
So that's just a little heel prick on your baby's foot. We need a little blood, and it's gonna test for a whole bunch of metabolic diseases. You're not gonna get the results right away, but usually the institution is supposed to contact you if anything is abnormal with your baby. You're gonna get the papers for the baby's birth certificate. Most exciting part, everyone wants to choose a name. What's the name gonna be? What's the baby's middle name gonna be? When do I do this? Who do I contact? We're gonna give you papers, guys. You're either gonna fill them out, give them to the hospital, or fill them out and send them from home, or do them on, the internet.
On the internet, exactly.
Yeah, that's when all this is gonna be done.
So a lot of patients will ask us as soon as they enter the room, how long am I gonna be here? When am I gonna go home? Again, this is all institutional. Depending on where you live, it'll be different. In Montreal specifically, the normal for our place of work is 24 to 48 hours.
4 hours for a vaginal delivery with no complications, and 48 hours, which is 2 days for a cesarean delivery.
And it doesn't seem like a lot of time, but that's why we need parents to stay really focused during these hours that they're with us, you know. We know that you want family and visitors to come, and we definitely encourage that, but we want you guys to really be able to absorb as much as you can during this time. So really be with us, we have you, and we want to be able to empower you guys when you go home.
If you love this video, subscribe, like it, share it. We really want to give this info out because it's just so important. We want you to have the best labor, delivery, postpartum experience, because parenting is hard.
It is.
Come on. So at least we want to help you before you get to that point. So
welcome to our medical mission. We hope you enjoyed this video. Again, as Amy said, like, subscribe, do whatever you have to do. Get the word out on who we are. Again, this is Nurse Carm.
Nurse Amy.
And that's it.